Hello everybody, my name is Kobe Pope, owner and creator of Wolf Self-Care Products. Happy Mag Facts Monday. Today we are talking about the central nervous system, stroke, head injury, and brain surgery in regards to magnesium. 3 things you need to know about magnesium in the brain. Magnesium protects the brain from the toxic effects of chemicals such as food additives. Magnesium keeps excess calcium out of cells. When magnesium is low, calcium rushes in, causing cell death. Number 3, when blood sugar and magnesium are both low, excitotoxins such as glutamate and SMG and aspartic acid and aspartame can more easily enter brain cells, causing cell death. Magnesium does much more than any drug to protect the blood circulation in the brain. It's a vasodilator, opening up blood vessels. It protects the endothelium, the innermost layer of blood vessel walls. It closes calcium channel to excessive calcium influx. And we're on the topic of magnesium deficient brains. With most of the U.S. population deficient in magnesium, many Americans are greater risk for a host of serious problems, including stroke and severe post-stroke complications. Depending on the degree of magnesium deficiency, there can be poor recovery from head injury and escalating neurological damage. Lack of magnesium can enhance neurotoxic damage from a vast number of chemicals in our air, food, water, and stimulating sensory disorders. The complexity of the CNS hyperexcitability due to magnesium deficiency is only now being appreciated.
If you don't have magnesium, you get constipated. You don't poop. If you're anxious, take magnesium.
Oh yeah.
Yeah, if you're anxious, take magnesium. It's good for muscles, good for bones.
Oh yeah.
Good for the bone. Eat your leafy greens.
Alright, so talking about some book called Magnesium in the Central Nervous System that was written in 2011. The chapters that are in are free magnesium concentration in the human brain, intracellular magnesium homeostasis, magnesium transport across the blood-brain barriers, intracellular free magnesium, and MGATP and coordinate control of protein synthesis and cell proliferation. Magnesium and the yin-yang interplay in apoptosis, which is cell death. Brain magnesium homeostasis as a target for reducing cognitive aging. And yeah, there's just a shitload of other chapters, but I'll show you all that.
Can I read a passage in the Magnesium Bible?
Sure. Let's see. So we can do.
Let's do head and injury. Traumatic brain injury. Traumatic brain injury says measuring magnesium ion levels in the blood after traumatic brain injury can be both diagnostic and prognostic value in treating brain injuries. Studies of animal and human brain trauma victims indicate that higher magnesium levels are associated with a better recovery. Intravenous magnesium sulfate significantly reduces brain edema following brain injury and is used without adverse effects to create patients with severe TBI. Magnesium depletion created by a head injury is slow to reverse. Magnesium takes 30 minutes to get into spinal fluid, 3 hours to reach the cortical area directly under the skull, and a full 4 to 6 hours for sufficient amount of magnesium to reach the deep brain tissues. Reading Rainbow.
Yeah. All right. Furthermore, if no supplements are taken, the deficiency is still present 3 to 6 months later. Okay, so they're talking about experiencing Navy SEALs and marathon runners show that after a month of intensive training, they experience magnesium deficiency. And if no supplements are taken, the deficiency is present 3 to 6 months later. It only makes sense that your diet is deficient and you're under stress, physical or emotional, and you replace magnesium in your stores daily. Now they're talking about brain injuries, alcohol, and magnesium. Binge alcohol drinking is associated with an ever-growing number of strokes and cases of sudden death, with alcohol causing spasm and rupture of magnesium deficient cerebral arteries. An animal studied high doses of alcohol instigate a rapid fall of level of magnesium ions in the brain and elevation of calcium followed by cerebral vessel spasm and rupture of cerebral blood fluid or blood vessels. People who consume alcoholic drinks a day, no, 3 alcoholic drinks a day can be deficient because alcohol blocks magnesium absorption as well as acting like a diuretic. In human studies, people with mild head injury have been found to exhibit early deficits in magnesium ions. The greater the degree of head injury, the greater and more profound the deficient in magnesium ions, the greater the level of calcium ions compared to magnesium ions, which of course is bad. Okay. Okay, so there's some studies. Migraines, headaches, dizziness, and hangover that accompany alcohol ingestion are associated with rapid depletion of ionized magnesium levels, but are not serum magnesium levels. The diagnosis is missed if only serum magnesium is measured, since magnesium is necessary to regulate calcium. When magnesium is deficient, it's the excess calcium that creates vascular spasms and pathology. Alcohol-associated headaches can be treated with intravenous magnesium. Okay, now we'll talk about stroke. Okay, all deaths due to stroke among 20 residents, which is 7,000 or 17,000 cases from 1989 to 1993, were compared with deaths from other causes, 17,000 controlled. It was determined that the higher the magnesium levels in drinking water used by the Taiwanese residents, the lower the incidence of stroke. Research indicates that the area of the brain damaged by stroke contains injured neurons that can remain hyperactive if they don't have enough magnesium for several hours. After stroke has occurred, damaged neurons are frantically struggling to survive. Oxygen, glucose, and magnesium are normal. Recent data indicate that alcohol-induced cellular loss of magnesium ions is associated with cellular calcium overload and the generation of free radicals. There's a whole bunch in this. I'm just kind of skimming through, so bear with me. Thanks for watching. Okay, now they're talking about 3 things we need to know about magnesium and brain surgery. Good neurosurgeons give IV magnesium to all their surgical patients. Magnesium helps the brain recover from brain surgery. Magnesium prevents post-surgical strokes and make them less damaging. Brain surgery and magnesium. During and after brain surgery, magnesium's many attributes come into play, preventing stroke, keeping calcium from entering damaged cells, reducing neuron excitability, and decreasing the incidence of seizure and spasm. Intravenous magnesium sulfate enhances the effects of general anesthetic, low post-operative pain scores. Okay. It is a safe and cost-effective addition to such general. Okay. Next topic: magnesium and seizures. The brain is in a constant state of electrical activity. Without calcium, magnesium. Okay. I'm talking about neurotransmitters. Okay. Calcium, magnesium, zinc, which play various roles in response of nerve cells to electrical stimulation. Brain cells altered by trauma chemicals or severe stress can be permanently switched on and off, fire excessively due to excess calcium in the damaged cells. Magnesium is deficient in people with epilepsy. Magnesium deficiency, decreased seizure thresholds, and low magnesium solution can generate spontaneous epileptic discharge from rats and hippocampal slices, which is done during a study. Okay. They confirm that magnesium is a potential modulator of seizure activity because of its ability to antagonize excitation through the N-methyl D-aspartate receptor. Okay, we're almost done. Magnesium and electromagnetic fields. EMFs can have positive effects such as stimulating bone growth. However, a study focusing on the negative effects show that EMF cause single-strand breaks in DNA. In fact, many people feel that EMFs can have many side effects in the body. This condition has been labeled electromagnetic hypersensitivity, which implies that only sensitive people feel these effects. Symptoms of electromagnetic hypersensitivity include headache, fatigue, stress, sleep disturbances, skin, such as prickling, burning sensations, rashes, pain, and aching muscles, and many other health problems. Whatever the cause, EHS symptoms are real and sometimes a disabling problem for those affected. EMFs are a stressor, therefore they can deplete magnesium. Mm, Calcium channel. Okay. Magnesium at a concentration of 10,000 times greater than that of calcium inside each cell allow only a certain amount of calcium to enter to create necessary electrical transmission. Then immediately helps to eject calcium once the job is done. If calcium accumulates in the cell, it triggers hyperexcitability and disrupts cell function. Mm. But yeah, that's pretty much all we got for the central nervous system, stroke, head injury, and brain surgery in regards to magnesium. Thanks for watching. You know, to shop for the best supplements, www.wlfclfcr.com. Thank you. Shopping, hope I got you. Come on.